Okay, welcome back to the Voice of Nursing. I'm your host, Julian. Today we have Barbara Rodrigues. She is a pediatric nurse operating in the UK. She's going to tell us her insights about her career and share something really, truly special with us today. How are you doing, Barbara?
I'm good, thank you. How are you?
Very good, thanks. Lovely to have you on the program today.
Thank you
So
for
starting
having
off
me.
with you're very welcome. So starting off with the first question, Barbara, your journey from starting as a healthcare assistant in a private clinic to becoming a pediatric nurse is inspiring. Can you share the pivotal moments that led you to specialize in pediatric nursing?
Oh, yes, thank you. Very interesting. I did start, you're right, as a pediatric healthcare assistant in a children's outpatients hospital in department. And it was very interesting, actually. I was enjoying my job as a pediatric healthcare assistant. I was working alongside nurses, and I was there for about 8 years. And every time my manager would ask me, "Oh, don't you want to be a nurse?" And I'd say, "Oh, I'm happy what I'm doing. I just love working here with the children, with the staff and everything." And said, "Well, I think you would do very well if you become a pediatric nurse, then you can take it further." So I said, "Oh, okay, that's fine. What do I have to do?" And they said, "Oh, don't worry, we'll second you. Actually, you'll be seconded and you'll be able to do your training. We'll support you, and then you can be a pediatric nurse, and then you continue to work for us if you want." And I thought, okay, I'll jump at the opportunity. So I did jump at it, and honestly, I've never looked back. It was the best decision I made. It's just nice to be able to do more in your job because obviously as a healthcare assistant, I was limited to what I could do. But as a pediatric nurse, I was then able to take more decisions more actively in supporting families and actually treating children. So I enjoyed that very much, and that's part of my journey.
Yeah, well, yeah, it all sounds like it inspired, a lot of that inspired your passion for pediatric nursing and how it's kind of evolved over the years since you began in the 1990s. I believe you transitioned to the NHS for your nursing training, which must have been a significant step. Can you discuss discuss your experiences there and how they shaped your approach to pediatric care?
I think how do I answer this now? This is very interesting. When I qualified as a nurse, I then went on, instead of staying in outpatients, I think I had an opportunity to work on the children's ward. And that was very interesting because I was then able to see sick children, because in outpatients, I actually did not see very sick children. I saw children who were coming in very well and coming in for follow-up appointments. So that was a very different type of nursing for me, but it was a very good way to learn. And it was a very good way to actually expand my skill as well, and utilize all that I've learned in the 3 years that I did my nurse training. So that was interesting. It inspired my passion more because I was now hands-on with the patients. I was doing parent-centered care, looking after children, and I was on an acute medical ward. So that was very good for me because it gave me a broad knowledge of other aspects of caring for sick children. So I looked after children with asthma, skin problems, heart problems, oncology patients, and it was very very good for me to have gone onto the ward and consolidate all that I've learned in my training. So that's how I'll say built my passion even more in pediatric nursing.
Fantastic. It sounds like it was meant to be. So you've spent the last decade, I believe, treating pediatric outpatients, particularly specializing in children with burns. What unique challenges and rewards come with caring for these young patients?
Wow. I have so much passion in looking after children with burns. And the reason I say that is because of the outcomes. I'm so honored and privileged to be able to be a part of that journey for them. Because when they come in after being after being subjected to a burn injury, the first thing that the family worry about is, are they going to be scarred for life? Because as you know, burns are quite traumatic. It changes the way the skin looks. You have to debride the burn, which means removing all the blisters, and a child ends up with thinking, will I ever get a new skin back? Will I have this mark for life? So for me, the challenge there is being able to support the family, reassure them, and actually them seeing that, oh, it was actually true what she said in the beginning, that this is just the first stage. Even though it looks horrible, in a few weeks' time, you're going to get your skin back and you're going to look a lot better than this. This is going to heal nicely. Even if we have to do a skin graft, after the skin graft, your skin's going to look much better. There's going to be a better outcome to this. And your child sometimes is never even going to see the scar. I mean, sometimes depending on the depth of the burn, it will just be minimizing of the scarring, which I think is a lot of, is a major thought in the mind of the families. So that's one challenge that we have in pediatric burns, but we always have to be there for the families. And I think just knowing that their child is going to come through is always the best for them, and they leave there coming back for dressing change and see the improvement all the time, and they're really grateful for the changes. So the challenges comes, but there's also good outcomes from it. So that's how I'll answer that one.
Fantastic. You've painted a really, really clear picture of it, of all the challenges, but more importantly, just how rewarding it is. So you spoke about how challenging it is for to provide emotional support to, especially, you know, the parents who are often dealing with guilt, fear, and anxiety about all of this. Is there any specific strategies or techniques you use to help the parents navigate these emotional challenges they face when their children are with you in care?
Yes, actually, we're very honored and privileged to have psychologists, children's psychologists, clinical psychologists present with us on our wards, and they're able to support families even further, apart from the support we nurses have to give. I mean, we're the first point of call because they come to us, and we then, obviously, we're treating the burn, so we're reassuring them, don't worry, it's going to be fine, you're in the right place. Your baby skin is going to be better, or your child's skin is going to get better. We're going to treat you with dressing, skin graft is required. We're going to monitor the child until the burn is healed, and we'll also provide aftercare for you, caring for your newborn skin following the injury. And all this reassuring is what the families really depend on. And it's rewarding because a lot of them come back later, weeks after, and say, wow, I really thank you so much for, you know, I didn't think that the skin would be a lot better like this. I didn't think you guys did a great job. And psychologists also help them to process their fears and their guilt, because a lot of these families come in and say, oh my God, I wish I never left that cup of tea. I feel bad now. I've scarred my child. And they're dealing with these fears. They're dealing with the fear that the skin will never become back. They'll never forgive themselves. They're also dealing with the guilt of why this happened, because sometimes it's a family member who's just left the hot drink. Of course, accidentally the child takes it, or the child knocks it over, or a child is in the kitchen while the family is cooking. So oftentimes what our role is to reassure them that everything's going to be fine, but also to support them in understanding that accidents do happen. Don't blame yourself. It's going to get better. It could have happened even if it wasn't you. It could have been with the auntie, it could have been with the uncle, it could have been with a friend. So it's continuously working on reassuring families that it's going to get better. And I think the more they hear it, the more they calm down, the more they're hopeful. So you're building that hope, and you're allowing them to know that they're in a safe place with us, and that their child is well looked after, and their child will come through this, and they will come through this as a family and look out on the other side and say, yes, there was an accident, but we have come through with a good outcome. So I think in the burns unit, what we encourage our families to do is not to blame themselves. is not to have fear about what will happen, is also to accept all that we're offering them and help them to get to a place where they're actually comfortable again and they're actually seeing progress, and that progress is making them feel much more better. So that's how we offer those emotional support, and our psychologists do a fantastic job in helping the families and helping them come to terms with it, and they support the children as well and talk through how they're feeling after their burns, and just help parents walk through it. So it's a privilege.
Fantastic. So just based on that, that particular kind of picture you painted for us so well again, more specifically, what was one of the more rewarding moments in your career from an emotional support perspective? For instance, are there any moments where a parent or patient has left a memorable impact on you because of your emotional support?
Yes, actually, I've had a lot of them actually, but there's one in particular that was very special. So we had a child that sustained a burn injury, accidentally, of course, and I was on the shift that night. They were very upset. I supported the family, helped the child calm down, brought some nice things to show the child all the toys, and sang songs with the child, and the child stops crying, and I just made it a little bit more relaxed for them, even though it was quite a big injury and the child was crying a lot. Eventually the child was playing with me, was laughing with me. We were having such a fun time, and the child forgot about the burn. So the next day, the mother said she couldn't believe it, that the child was in so much tears. The child hasn't stopped talking about you. I came back to the shift, and the child was asking for me almost every day, saying, when is Barbara coming back? And it became a fun moment where the dressing was there, but the child was not focused on that. The child was focused on the fun we were having, the songs we were singing together. And that was taking their child's mind off the burn. And this was also helping the parent seeing the child in that state. They as well felt a lot more relaxed and happier about the situation, and they were hopeful that, oh, my child's happy, so I'm happy too. It was memorable for me because they went on to give me cards and gifts, and the child made a lovely card for me and drew a picture of me and her, and said how I was like an angel to her and how she would never forget me. And I think that was so memorable for me, because the fact that the child went out of their way to draw a picture of me and her, and I think that was very special. It was very memorable. I don't think I'll ever forget that. It happened ages ago, but it's still very much imprinted. And it just goes to show that, you can't take their minds off things. The language of childhood is play, it's fun. If you can bring that in, no matter the traumatic situation they're going through, it does go a long way to help.
Fantastic. Well, yeah, it sounds like a really memorable experience, although I'm sure, as you said, you've had many. So just based on that line of thought, do you have any advice for fellow healthcare professionals, especially nurses, who are providing empathetic care to parents who are going through such difficult times?
Yeah, I think one of the things that I always teach junior nurses and new staff is to always be empathetic, and always kind of think to yourself, if I was in that situation, how would I feel? And always come across as that that you're there to support them, and put yourself in a position where they can talk to you, where they can feel comfortable with you, and also bring yourself down to a level where you can relate to the child on a friendly, like I said, play is the language of childhood. Learn to play with the children, learn to sing with them, learn to do what they associate as fun, to take their minds off their injury. And in terms of a difficult situation for the family, I think your gentleness, your listening to them, you're reassuring them. Being able to reassure families is one of the greatest things that they need when they come to hospital following any kind of injury. Is the reassurance, is the support, is the knowing that we're in a safe place, is the knowing that you're going to do the best you can to help them. And listening is very important. Communication and interpersonal skills is one of the major things that a nurse must have, or any healthcare professional. You should be able to communicate effectively, be very rational, be very thoughtful, be very kind, be very compassionate as well. Compassion is a very important thing, because you're dealing with someone who's already scared, who's already worried, who's already guilty, who's already feeling a lot of emotions following their child's injury, and who's confused as well, doesn't know what to do. So all that, your position as a healthcare professional, they're looking up to you. They want you to help them, so they're coming vulnerably to you. So your approach to them will be to support them as much as you can. And those special skills are very important. Just being caring, just being loving, and always being professional as well, knowing that you're there as a healthcare professional to help them and assist them. And I think those are the things that you need to always have when you're dealing with patients and parents of families who are going through difficult situations and come to you for help.
I think you explained the next 3 questions I had for you in one go. But thank you for being so thorough. It's actually fantastic to hear all the intricacies, because you flowed from one question or one answer to the next so nicely for me. So it's packaged it all up in one fell swoop, which is fantastic. So it might sound quite trivial at this point, but what major challenges, besides the ones that you mentioned, have you encountered in your overall career as, first a healthcare assistant, and then a pediatric nurse, and now someone who's a mentor? So essentially what I'm asking is, how have they shaped your advocacy for emotional support and mentorship in pediatric nursing, these challenges?
Yeah, that's a good one. I think I will never forget an experience that has really shaped me in terms of support and a challenge as well. I was a senior nurse at that time on a pediatric ward, and we had an oncology patient who was in a palliative position. So we knew that the child was palliative. They didn't want to go home to lay to rest. They wanted to be on a pediatric ward where they had all our support. And I happened to be the bleep holder that night. And when I came on the shift, I was pulled aside by my colleague who was handing over to me that, Barbara, we're sorry to let you know, but I think this child is going to be passing away over the night. And that was my first pediatric death, actually. The good thing is we haven't lost, we don't tend to have children dying a lot in pediatrics, because there's always wonderful treatments given to them. But on this occasion, this child had a cancer, and he had an illness that was definitely not going away, and the child was passing away. Everything that was, we were actually just keeping them palliatively on the ward. And the parents knew as well that the child was eventually going to die, but we were keeping them as comfortable as they can. And they wanted to be with us, which was lovely, that we were privileged to be there for them at these last days of their child. At the time, I think the child was 3 years old. Emotionally, that was very, very heavy for me when I got on the ward, because I knew if it does happen, it was going to be on my call. I would have to be there, call the doctors to come and sign the final papers that the child has died, and I was going to do all the paperwork, support the doctors and support the family. So that was a big challenge for me. So I needed to put on my coat of braveness as well, and also have that support ready to give to whoever needs it that night, even though it was quite challenging. So when the bleep went, And I was told, you have to come now. The child has stopped breathing. So I called the doctors. We all went in there, and I walked. It was the first time we were told in pediatric nursing when we were training that don't cry in front of a patient. But I think in reality, you crying with them gives them a different comfort. And that day, the mother was crying. And as I walked into the room, she just held me in her arms. And I held her. And I cried with her. And I sat with her. And the doctor came in and also shed a tear. So we were all human around each other. And they felt like we were family to them. And for me, that goes beyond just what was written on paper. It's being there for them through that time. I sat with them. I told everybody else I was busy now. I'm going to stay with this family and be with them throughout. And normally when a child dies, we will cover and they will come and take the body away and take it to the morgue downstairs. But on this occasion, I stopped everything and I allowed the family to stay with the child as requested, that they want to still have their child with them. They want to still be there and just take in the moments, the last moments. So I sat in with them as long as, and I think I went over my shift for that. It was okay. I just sat with them as long as they wanted me to sit with them. They talked about the next steps and what they're doing. And I just sat there and held her hands, and just being there for them was all they wanted through that moment. And I think that was challenging, but it was also rewarding in a very different way, because I was able to play the role of a family member in a different way, if you see what I mean. Even though I'm not family, but they embraced me as family that day and wanted me to stay with them in the room and just sit with them, and take in those last moments. So for me, that was a challenge, but it was also a rewarding challenge, if you see what I mean. I wouldn't know where or not any other way to put it, but it stuck in my memory. I think this was quite a many years ago, but it did stick with me because it was my first pediatric death that I witnessed, and it was the last. So, but it was a memorable one for me.
Wow. Yeah, it's quite amazing to see just how human of a moment you guys could all have together, especially concerning what they had told you in training, for you guys to just, I guess kind of go against that idea that you need to remain professional at all times when, we're all human and we all need to experience a human moment together, as you described it. So yeah, it must have been absolutely harrowing, but it sounds like the way that it was dealt with came completely naturally, and that's fantastic to hear that the outcome at least, seemed cathartic, like people could heal. So not to move on too quickly, but just how do you manage the emotional toll that comes with caring for these patients and their families? Are there any self-care strategies that you would recommend for other people that you've found that work?
Yeah, do you know, it's really funny because recently I chose to become a staff and well-being champion. So my hospital is very hot on ensuring that staff emotional well-being is looked after. So we have got things in place. There's special guardians you can talk to if you're worried about anything. The employee relations can help you with stuff that if you're dealing with anything that you want to talk about and point you in the right direction. And I also think there's also all kinds of things that people can do. When you leave work, they do say try to leave work at work. Very difficult for a nurse to do that because you're there for 12 hours and you've made memories in the day, and sometimes some of them are challenging, some of them are beautiful. So sometimes you share with your family that, oh wow, this was lovely today, I saw this child walk again, or there was a patient did so well today, blah blah, a child that was crying all the time smiled today, or whatever. However, what you do outside work is very important. I think it's important for nurses to have a very good social life and a very good relationship with other people outside of work. enjoy friendships, enjoy going to swim, enjoy going to the gym, enjoy going to parties, enjoy listening to music, whatever makes you relaxed and happy. Whatever you do, if it's spending time with family, if it's spending time going out to eat with family or friends, doing something fun to take your mind off everything that you may have experienced at work, be it good or bad. I think that's very important. Having talking therapies, if that's helpful for you, if you need to speak to a counselor and to process things. We've also got psychology at work. You can speak to psychologists as well and tell them, oh, I need a debriefing on something that happened. I think I'm finding it difficult to let go of the thoughts of what's happened with that child or what's not happened. And we've got all these things in place. And I think it's very important that nurses and doctors and healthcare professionals take responsibility to ensure that their emotional well-being is looked after. Because if your emotional well-being is looked after, then you're able to give out from what you have. But if you're struggling, then you're not able to help another who's struggling much. You need to be in a good place where you can give out something as well. And I'm not saying that when you're struggling with something, you can't actually come to work. Yes, you can, but it's very important that you're putting things in place to help with dealing with your own issues so that you're coming strong when you're coming to deliver to a patient and a parent, because the parents look up to you. They look up to you so much for their support. Sometimes when a patient's parent sees you, the first thing they ask is, oh, is everything going to be okay? Oh, do you know what's happening today? Can you tell me, is my child going to be all right? Yeah, I've been doing this, but do you know if it's going to be fine? So they're depending on you. You're building that relationship of reassuring and all. So you've got to also have something in yourself where you're confident and you're coming in a place of strength to give strength to another. So I would say my hospital is doing very, very well at continuing to extend that extra to their staff and ensuring there's lots of staff and well-being programs running in the hospital to encourage staff to take part in them. So it's all good.
Fantastic. Yeah, I would tend to agree with you. I think sometimes you got to take it back to basics, do the things you enjoy, ask others for help, find solace in those things that work for you, and find solace in people that are willing to help you. I think it's all a really important message. So yeah, Barbara, I think you've done a fantastic job at telling us about your incredible career, what it really means to give people support, and the importance of also self-care and what that means for the new generation of nurses coming in. So thanks for all your time. First of all, thanks for the interview. If you guys like this content and would like to see more, please hit that like button, subscribe. It really helps us out in the algorithm, and we'll see you next time. Cheers, Barbara.
Thank you so much.